Good afternoon, and thank you for joining our section titled Breaking the Silence About Infertility in the Black and African American Community. Our program is generously funded by the New Jersey Department of Health and hosted by the Partnership for Maternal and Child Health of Northern New Jersey's Perinatal Mood Disorders Initiative. I would like to also thank our generous sponsor, Horizon New Jersey Health. For those of you who don't know about our organization, we are a nonprofit committed to improving the health of women, children, and families. I encourage you to visit our website at www.partnershipmch.org to learn more about the different programs that the partnership offers. My name is Lauraine Jondoh, a Perinatal Mental Health Coordinator, and I'll be facilitating this conversation with Dr. Stacey Edwards-Dunn. Please know that you will be allowed to ask questions at the end of our discussion. I am inviting you to use the chat box to type your questions in, and we will try to get through as many as possible. Dr. Stacey Edwards-Dunn is a sought-out preacher, speaker, and certified coach whose professional leadership and accomplishments span the fields of healthcare, ministry, and community engagement. She holds a BA in chemistry, a Master of Public Health and Divinity, and a ministry doctorate. Dr. Dunn spent the earliest part of her life teaching reproductive health education in the inner city of Chicago, where she served as a health educator at Winfield Moody Health Center. She also served as a health center manager, a director of community education at Planned Parenthood. Dr. Stacey continues to serve the community by advocating for families in the fight for fertility through her organization, Fertility for Colored Girls, a nonprofit organization dedicated to increasing access to fertility care for Black and underserved individuals through education, awareness, and support. Dr. Stacey is married to Earl Dunn Sr., and they are proud parents of their daughter Shiloh Lupita Iman Dunn and a puppy Simba. Without further delay, please help me welcome Dr. Stacey Edwards-Dunn. Dr. Stacey, thank you for joining us today. We will be addressing a taboo topic in the Black and African American community, and that is infertility. I have always admired your transparency and devotion to families who are on their journey. Dr. Stacey, take it away.
Well, thank you so very much for having me today. I'm honored, Lauraine, that you all have chosen me with you on today. My particular journey started in 2007. In 2007, I got married to my husband. I was 37 years old. And at that particular time, I had done everything. I felt like I had done everything that I was supposed to. I had went to school. You heard the number of degrees I had. I had established my career. And I finally got married, and I was ready to build my family. And so as we moved forward to begin to build our family, we began to have troubles. And little did I know, at the latter part of 2000, the beginning of 2008, actually, that I would be diagnosed with infertility. Infertility was not something that I had ever heard about in our community because infertility is a taboo topic in the Black community. My girlfriends didn't talk about it. Nobody at church talked about it. Nobody in my home really talked about it. But, and so as a result, I was really caught off guard because it had been told to me, as with many African American women, that this is not something that we struggle with. Black women were supposed to be baby making machines. And so we should basically be able to get pregnant at any time. Just by looking at each other, we could have babies. But I would find out that would not be the case. And so both my husband and I were both diagnosed with male factor fertility as well as my own diagnosis. And so that would begin my journey with infertility. And what now has, I think has also become my labor of love for the work. One of the things I would find out as I was diagnosed, is that Black women were struggling more than I knew. Matter of fact, according to research and statistics, there are approximately 7.3 million women and couples who struggle with infertility. And amongst that, what we have found is that Black women and couples, or women of African descent, are struggling at 2 times the rate as our Caucasian sisters and brothers, and are less likely to seek access. And so when I began to find this out and research this, and also as I continued on my own journey, um, I would find that, one, when you went into the fertility clinics, there were very few Black women that were in there. Um, and again, there was nobody really, really talking about it. And so, and there was nowhere for me to go as a woman, as a Black woman who was on this journey, also as a minister. There was no place for me to go to share my own unique experiences and how I was feeling around this journey. And so, as a result, I feel like God also kind of forced me into beginning to share my stories. One of the things that began to happen with me, Lauraine, is that as I was on my journey, and I was on my journey for 7 years at the time, I had multiple doctors. Um, I was still working at the church. I worked full time at the church, and there were women and couples who began to come to me to talk to me about their infertility, and they had no idea that I was struggling. No idea that I was struggling. And so, in counseling, coaching them, I would in turn share my story with them, and they were in awe. But what I found is that these women were coming to me because they had nowhere to go. God was leading them to me, but I think God was leading them to me to show me that there was a huge void in our community. There was no space for us to go to share our business when we're told not to share our business, right? So we need some safe spaces, right? To share our business, to share our hearts, share our concerns around this journey. And so as they shared and I shared, I realized that sharing my journey, sharing my story it becomes very powerful, because in our communities, most of us, we all know about stories, right? Since we were born, we've listened to stories, and then particularly in the African American community, stories are very, very, very significant. We are an oral people. And so we heal, we connect, things become personal when we hear a story is told. And so I found that it was just so important that I shared my story, because other women needed to know that they were not alone, that they too were, that there was somebody that looked like them, that knew what they were experiencing, um, that could get it. And so as a result, I began to share my story so that I could begin to help and support other women, and we could support each other on the journey.
That's awesome. And since you are familiar with the pain of infertility, right? Can you discuss the emotional challenges that comes with that journey, and how do you maintain a healthy mental space during that time?
Well, infertility it's devastating, right? It's again, particularly in our community, is something, first of all, that most of us never think that we'll have to experience. So it's like being on an emotional roller coaster, right? And so I think that emotionally, mentally, spiritually, it's imperative that in order to care for yourself mentally, that you have safe spaces where you can share about your journey, and share in spaces with other women and couples that, and persons that keep what you share confidential, right? That they don't judge you, don't critique you, but they love you and they hope with you in the midst of it. And so for me, I think that that's one of the pieces that becomes very, very important, that we have safe spaces where we can go unload and share. So many of us, particularly of African American women, we take on so much. And when I say take on, we not only, seek to care and nurture everybody else, but when we take on the weight of the world, and then our own infertility journeys, so much that it really becomes cellular, right? And
Mm-hmm.
what happens is that when we carry this weight, you know, our bodies, I talked about this on our prayer call on Monday, is that we get to a point that our bodies cannot even take it, right? They begin to break down. And so you have to get to the point that you have to expel it. And when I say
Mm-hmm.
expel it, you have to share it. You got to share it with someone. And so I think that that becomes very important, having safe spaces where you can share it. I think also what helps mentally and spiritually is that making sure that you know, you have your own meditation life, like, you know, so that you can center yourself on the journey. It's very,
Mm-hmm.
very important that you are pay attention to your breathing. And again, that you're meditating and centering yourself, because infertility it will jerk you around. And, you know, it's so many distractions, and it can really mess you up. I think in addition to that, I think paying attention to the types of foods that we are putting in our body, because those
Yes.
as well also impact us mentally. If we're taking in a
Mm-hmm.
lot of sugars and, you know, carbs and, you know, other things, those types of things have the capacity to impact your mental health as well. And so I think that really how we care for ourselves is very holistic. And finally, I would like to suggest, I have a girlfriend, she just created this new shirt, and it's called, you know, basically it talks about how um, you have to make yourself a priority, right?
Of
And so
course.
part of this idea of caring for ourselves mentally is that we realize, particularly as women who have been kissed by nature's son, is that
Mm-hmm.
we have to take time and carve out time for ourselves so that we can care for ourselves, right? So just as we put appointments in our phones and on our calendars for so many other things, it becomes very important that we also put ourselves on our calendar to care for ourselves. And knowing
Mm-hmm.
that also when you're on this journey, we also have to know when to stop, when to pause, to give ourselves a break so that we can have a sense of clarity of mind so that we will know how to move forward. And so I think those become the things that become very, very important. But also, finally, I would suggest just knowing that you are not alone. You are not alone on this journey.
Mm-hmm.
There are so many other women and couples, and particularly even with my organization, I always say it's a village of women and couples who are going through, who are there for you. So you don't have to cry alone. You don't have to go through this alone. There's so many people who have experienced what you've experienced, also who have been through some of the treatments that you can gain knowledge from and tips from and even buddy up with in order to move forward on this journey. So that's what I would suggest could be very helpful for those, you know, who might be struggling with mental health, the infertility journey might be impacting them mentally as well.
Mental health. Of course, of course. And one of my favorite quotes is when people are heard, they feel seen,
Yes,
right? And being a part of a community where you are being heard, you are being held, will make you feel like less alone. And that is the goal here, that there is a community out there willing to embrace you and welcome you in a circle. So thank you for sharing. And we're going to dive in a little bit deeper, right, by addressing the social economic disparities that exist in infertility care in our community. Can you address that?
well, certainly. I think that when we look across the board, just with healthcare in general, there are a number of social economic barriers, right? When we begin to think about infertility, um, socially, economically, we do know that Black women are less likely to seek access. One is
Mm-hmm.
because of knowledge, lack of knowledge around infertility, around treatments, et cetera, and the myths. But ultimately, one of the reasons why what we have found is that many of the Black women and couples who struggle with infertility, they do not have the financial wherewithal to move forward, right?
Mm-hmm.
So whether it's lack of insurance, We know that there's approximately 17 states in the United States that provide fertility insurance, and many of our women do not have access to that insurance to pay for treatments like an IUI that may cost $6,000 or $7,000, or IVF that could cost $15,000 to $20,000, right? Or to pay for donor eggs that cost, $12,000 to $15,000, a donor sperm, or even to pay for a gestational surrogate, because gestational carrier. Because the reality is everyone will not be able to carry their own child. And so some people would like to be able to use a gestational carrier, but the reality is gestational carriers cost an upward of $80,000 plus. And even when we begin to talk about domestic adoption, most adoption agencies cost between like it starts at 18. Most of them start at $25,000. So a lot of people even say to Black women and couples or women who are struggling with infertility, just go ahead and adopt. Well, the reality is that adoption is just as expensive. And so when we think about that, it becomes very challenging for us to access the care and the treatment that will be needed to become parents. And so one of the goals of my organization is, in addition to providing support, we also provide grants. We have a number of grants that we offer throughout the year. Of course, we don't have enough for everyone, but we do our best to raise money all through the year and connect with other organizations to help us to establish grants to give away. And so usually Fertility for Colored Girls gives about $75,000 in grants away a year, just from our organization called the Gift of Hope Grant, that will be coming out in April. Actually, next week, we should be releasing our application. So for those who are listening and watching, please make sure that you check our website. Just last year, we worked with Kind Body Fertility Clinic. They gave us $50,000, and we were able to give 4 grants to 4 Black women, 3 free IVF cycles and 1 crowd preservation cycle last year. And then we also have a partner, EMD Serrano, who provides grants to us as well. And they are medication grants, because medication for IVF is quite expensive, sometimes $5,000 to $6,500. And so Fertility for Colored Girls, because of this particular partnership, we are able to offset $4,300 in those expenses so that the women and couples do not have to pay as much. And so those become some of the economic, barriers. And then, when you begin to think about locations of some of the fertility clinics, it's very few fertility clinics in the Black community. And so we have to travel to obtain access to those particular, clinics. And so if we don't have a car, to me, that's a socioeconomic barrier, right? Because, then we got to get a bus, and we got to pray that the bus, and if it's not a train, can get in that community. And so, yeah, we have Uber, but again, there are some financial implications across the board for women of African descent who are trying to obtain access to care to become a mother. And so I think those become some of the things that, some of those barriers. And so, again, some of the things that become very important for Black women and couples who are experiencing those socioeconomic barriers regarding the financing piece, getting grants, paying attention and researching grants become very important. We'll be having a program next week. One of the things that also becomes important is knowing how to navigate the insurance that you have and really leveraging it, maximizing it. Even if you don't have fertility insurance, knowing how to utilize that insurance just simply to maximize it with your OBGYN before you go to a specialist, right? We have a number of women who also have worked at places like Starbucks or Twitter, who, Starbucks and Twitter, those organizations have excellent fertility insurance. We have a young lady in Atlanta who got a part-time job at Starbucks so that she could have fertility insurance. She is now pregnant. And so, those become some of the very creative ways that, you can you can obtain the finances as well. There's all type, and then you can also, one of the things we're finding, I know this is a little off from your question, but I think that's very important. And as much as we have barriers, we have to know how to overcome those barriers, right? And one of the things
I
we're
agree.
also finding from our women is this, that many of our women, like if their jobs did not have fertility included in their insurance, they have approached their employer and told them that, hey, my husband and I, or myself as an unmarried person, if the person is unmarried, they said, I am struggling with infertility and I need my insurance to include this. Many of
Mhm.
these employers that they have approached have really, and the HR departments have advocated on their behalf to ensure that the benefits, are not, those fertility benefits are included. And so I think that's wonderful. So the other piece for us, I think both mentally and then when we think about overcoming barriers, we too have to make sure that we have the tools in our toolbox or the partnerships with organizations like Fertility for Colored Girls so that we can advocate for ourselves and
Mhm.
stand firm and go before these persons and say, hey, I need help. And, I need you to do this, this, and that, or even speaking to insurance. So I think that that becomes very, very important as well with overcoming, these socioeconomic barriers. And even like with the fertility clinic, Lauraine, one of the things, if you don't have the money to um, pay for like your medications, I would encourage the patient to ask the fertility clinic, do you have any medications or samples or donated meds that you can provide for me, because I just
Mhm.
can't afford it. And so again, I think that we have to make sure that we are as equipped as we possibly can be to ask the right questions so that it
Mm.
can help us to obtain our goal.
Yes, yes. Advocacy, asking the right questions are
Right.
the key.
We
I
got
like that.
we got to be brave chicks, right?
Of course. And as a fertility coach and the founder of Fertility for Color Girls, what are some cultural barriers, right?
Yeah.
We talk about the financial barriers and socioeconomic barriers, but what are some cultural barriers that you see when it comes to infertility?
Well, there are a number of, cultural barriers for us. I think one of the first ones that I think of is this idea around the myths, particularly. That's first where I would enter in around infertility, that most of us think that we are hyperfertile, and that is absolutely a myth, right? We are born with all of the eggs that we are going to get as when we come into this world. And each month from the day that we are born, we lose eggs, and we are, each of us are at risk of, having some type of fertility challenge. And so I think that when we can come clean with that and we can recognize that infertility is actually a dis-ease in our community, right?
Mm.
And it's something that we experience. And it's not anything to be ashamed of as strong Black women, because I think that's another piece, for us as a barrier, particularly for Black women and men. We got to be strong Black women. We got to be strong Black men. And, infertility or, um, uh, you know, um, is not, again, not some, it doesn't make people perceive that we're strong. That means we have a problem or issue. It's just simply a diagnosis. It's a dis-ease, right? Again,
Mhm.
a diagnosis. And so when we understand that it is a diagnosis and it is a dis-ease that there is treatment for, I think that
Mhm.
then, and that other people are experiencing. And guess what? Not just people that are around you, but there are probably stories in your family where women or men have experienced infertility and did not share. And so when we can move beyond the shame of that and then understand that we still have value even with the diagnosis, I think that then um, we will have a greater footing. So I think that that's one of the major issues that we deal with. In addition to that, I think one of the other issues that we deal with is that when we think about most people think that infertility is a white woman's disease, right? Again, that Black women don't experience it. And so even when you begin to look at many of the fertility clinics, even though some of them are beginning to come along, but a lot of the marketing of fertility clinics, you don't see anyone that looks like us, right? We don't see Black babies. We don't see Black women and couples in the marketing on their websites. So I think that becomes an issue as well for us. And so, and then when we go to the clinics, we don't see anyone a lot of times that look like us either. From the parking lot, and not just in the parking lot. And that's what I tell fertility clinics. I said, you know, Black women and couples need to see doctors that look like them. They need to see nurses that look like them. We don't just need to see people cleaning the bathrooms or out in the parking lot that look like us. We need to see people at the front desk that looks like us. And when we get there, value us and partner with us in our experience. Don't make us feel less than, or don't make us experience multiple microaggressions when we come to the clinic, but value us, value our stories, and meet us where we are. I think that becomes very important as well. But I think that those are some of the issues that we deal with in clinics as well. I was actually at a clinic not too long ago. I'm not going to say a name. And I was listening to a woman that had just had a transfer. This Black woman, I was also listening to the other conversations. And actually some of the women were white, but this one particular woman was a Black woman who had just experienced a transfer. The conversations around me with the white women in the space was very different. They were answering those questions. They were providing a lot of information, but they were very short with the Black woman in the space. And actually, I had a situation there as well. And so one of the things that becomes very, very important is that treat Black women. I think it becomes very, very important that Black women and other women of color are treated the same as your white patients. We all should be treated with value. We should all be affirmed. We should all be met where we are, and then understand that each person that comes into space, that place, whether white, Black, Latino, Asian, or whoever they may be, we come with our own unique experiences to the place. So meet us where we are. Don't make assumptions, but meet us where we are. And so I think those become some of the things. One of the other things you mentioned, Lauraine, when we think about the unique experiences of Black women and some of the barriers and issues that we deal with, again, is this idea that, we don't like to talk about this idea of infertility because we have been taught not to share our business. As little girls, we were told that, what happens in this house stays in this house. You don't tell people your business. And so I think that becomes a barrier for us because, again, if we don't share with someone, there becomes this buildup, which of course, it then begins to impact your own self-perception of who you are, but it also begins to impact your mental health as well. And so it becomes, again, very imperative that you have safe spaces where you can share about your journey. Another thing I think too, and I want to just share this real quick that just really comes to mind, is one of the things I think that we don't realize, and a lot of people don't realize, particularly about this idea of infertility in the African American community. Much of these myths and issues really come from slavery, breeding myths, right? So when we were brought here to the United States and the Caribbean, we were brought here as a commodity, right? We were looked at as commodity, right? And we were only looked at as the ability to be able to breed so that we can build an economy, right? If you, as a Black person, as a person of African descent during slavery, was not able to give birth or was found to be infertile, the reality is that you would be treated much harsher. So no one wanted anybody to know that they were infertile, whether men or women.
Wow.
Because that meant harsh treatment, right? That meant also that you may be sold even quicker, right? So there were a number of repercussions, right? And consequences of being, if you had to say you were infertile. It was a lot of shame And it's that shame that I think that we carry from generations of shame around infertility. And so one of the things I want to say to Black women and couples or women of African descent and even of the diaspora that is on the phone, infertility is not who you are. It is a diagnosis, right?
Mm-hmm.
You
Mm-hmm.
are fearfully and wonderfully made. You are valuable. You are deserving of becoming a parent. You are worthy. You are beautiful. Infertility is simply a diagnosis, and it is it is a diagnosis, but you can still become a parent. There are multiple paths for you to become a parent. And so do not allow a diagnosis to stop you from obtaining that which you believe that you have been called to do. And so I think that that becomes very, very important too for women, who are watching and men who are watching.
Oh, thank you. That was amazing. Like I caught the spirit. And thank you for that. And you touch base a little. You touch base on the lack of representation in
Yeah.
these fertility clinics, right? And what strategy can you share with providers who are supporting families of color with their journey? What tips and tricks do you have for them? And
Well,
you
I
touched base a little bit, but can you elaborate?
that again, as I stated, one, including, making sure that your marketing is diverse. It should be
Mhm.
inclusive. Everyone that comes to your clinic should see themselves in your marketing, as well as your staff, right? I think, the other thing that I talk to clinics about, and I've also been doing, is providing training, to those, to those like cultural sensitivity training
Mhm.
uh, to those particular providers as well. And I've also talked to providers about the fact that Black women and couples want you to partner with them in their journey. Don't dictate to them, but partner with them. Again, letting them know that they are valuable. And so I have really been working with them around that. And then I think also in the Fertility for Colored Girls, we, in every state that we're in, and even some that we're not in, we work with fertility clinics, and particularly around this idea of education. We vet them and we say to them what Black women and couples, have told us that they needed from their providers, from the staff, and not just the provider, because the reality is that different people touch them. So we need to be treated um, as if we have value at the front desk, at the receptionist, to end the actual the room where they see us. We even talk to our providers about the language that they use with us, because there have been some things that have been said to our women and couples that have made us distrust. And medical distrust is a huge issue in the Black community, period, and even
Yes.
in across the fertility world. And so the importance of them building relationships with their patients, so that the patient can know that they trust them. And part of that is them educating themselves on the nuances and the language and the narratives that they speak, to the patients who are of, African descent. And so that's what we try to do with with the fertility clinics and the providers that we work with across the board. Um, and they too have to be open, right? To hearing that as well, and really pushing them to make sure that they're critiquing themselves so that they become conscious of their own biases that they are
Yes.
presenting in these spaces as well. And so
Yes.
that's some of the work that we do as an organization. That's some of my own, really, also outside of Fertility for Colored Girls, but also coinciding with Fertility for Colored Girls, that I have begun to do as well, is providing these trainings for these teams so that they will be better able to treat and love and give hope to the women that are coming, to the women and couples that are coming their way. But
And
part of that really begins with them. It really begins with the individual, because if you have not taken the time to do the self-reflection and look again at your own biases, then that becomes an issue. Then you will not be able to provide adequate and appropriate and healthy and quality care to the patient that's coming into your
Mhm.
space.
Oh, that's amazing. Those are great tips. And I want to touch base a little bit on the statement when parents or parents mostly, right, share with their children, pray about it. I'm struggling with infertility, just pray about it. So people tend to marry the prayer instead of trying to seek care. What do you have to say about that?
Well, I definitely think prayer is important, but and um, I would we can't. I think we should pray and put faith to our feet, right? There are things that we have to do, right? Um, God is not a Santa Claus that just throws out the gift of a child when we want it. So yes, we should pray and make sure that our hearts are really in line with the will of God for our life. And what people need to know who are simply trying to really kind of shut people down by just saying, just pray about it, is that person, whether it's a parent or a friend, they really need to take the time to really understand the diagnosis and the impact and the implications of infertility on their loved one, right?
Mm.
And so I think that that's very important. And so it's very comfortable and easy just for me to tell somebody just to pray about it, but it's harder for me to be still and listen and be present to listen to what this person is going through without
Mm.
critique, without offering uh, we're not asking you, people who are going through infertility, we're not asking you to give us any answers. And so we don't need you to volunteer to tell us what to do, whether it's pray or try to just adopt. What we need you to do is to be present, listen, and figure out how you can support us. Ask us how you
Mm.
can support us. And then, usually when people say just pray, I'm like, what you think we're doing? We've been praying about it. You know what I mean? And so I think that's the other thing, is that we have to know how to respond to people who come to us with the God notions as well. I believe in God. I'm clergy and everything. I believe in the power of prayer, but I also believe that, um, you know, um, again, like I said earlier, that God isn't like this genie or Santa Claus when God answers prayer, God does not always answer prayers. Yes, here it is.
Mm.
Sometimes there's some things that we have to go through. Sometimes things are delayed, but doesn't necessarily mean denied, right? But
Mhm.
it's delayed so that we can discern the path and the options and what God is seeking to do in our lives to get us to our destination. And so I think that that becomes important as well. So I think having conversations, with the people who have prayer, sometimes you have to say, I mean, really, what do you think I do? I've been praying about, right? I've been praying, but just because I have not been praying, just because I've been praying, it does not mean that God is saying no either. I mean, it may be
Mhm.
God is saying not yet. Um, and understanding again, really talking to your loved one, because most people do not really understand the implications, the context, and the complications of infertility. And so I would encourage the person, instead of getting angry, even though it makes you angry because you're already angry because you can't become a parent,
Yeah.
utilize it much as a teaching moment. I think every time somebody does that to us, we have to look at it as a teaching moment and an opportunity to educate people
Mm.
about what we're going through. Because
Mm.
if we don't say something, they will never learn and understand the real issue at hand.
Oh, that's great. That's great. And this is the most important question.
Okay.
And that is, how do you make love last during this journey of infertility for the married folks who are struggling emotionally? How do you make love last?
Well, I think that you have to make sure that you're always scheduling time for for yourself as a couple, for those who are married. And when we think about for particularly Christian marriages, I think that you have to keep God at the center of those marriages, and always remember why you got married at the first place, right?
Mm,
So, and allowing that to bring you back to the center. But really making sure that you're taking time out for yourself as a couple, right? You still maintaining those date nights. You still making sure that you carve out time for yourselves, and that you're listening to each other. The couple, whether it's same gender loving, heterosexual, or whoever it may be, LGBTQ, whoever you may be. The reality is, it becomes very important that you take the time to listen to each other and to support each other and hear each other wherever they are. And then also understanding that um, people process, um, you know, people process grief and the pain of infertility different. And just because we process it and we grieve different, it doesn't mean that it's deficient. And so I think that that's important, for couples that are in heterosexual relationships. And one of the things I hear, particularly from women, is that they say, "Oh, he doesn't understand," right? Whether if they have children or they don't, they're a man without, that does not have children. We automatically think that they don't understand because they're not responding like we do. One of the things I found on my particular journey and 7-year journey is that my husband was processing differently. I was crying and broke down pretty much, all the time. He wasn't showing me because he was trying to be the rock for me. And so what he would do is get off the phone and go play golf, or, go do this and go do that, or go into what I call the man cave to process. But giving each other the space to process, but also honor each other's feelings, um, you know, along the way. I think that it's very important that you communicate about how you're feeling and where you are. Doing pulse checks. It's very important that you have a counselor on this journey as well, and
mm.
making sure that your relationship doesn't just become about the baby, right? Um, but again, you understand why you got married in the first place. And so I think that those are some of the ways that you make love last. But I encourage everyone, for those persons who are married or just simply have significant others, please make sure that you have a counselor, someone that can constantly kind of give you what I call a tune-up, and help you kind of check in, so that they can be a mediator to help you all to continue to talk as well. I know one of the things that helped my husband and I as well was that along our journey, there would be times that he would say, "We need to take a break." Even though I
Mm.
would, we don't have time to take a break. He was like, "No, we need to take a break so that we can grieve, we can process, and take a breath before we move on, to another cycle." And so again, being willing to listen to each other as well. And so I think that those become some of the ways that you can make love last.
That's awesome. And the final question that I have for you, and that is, what are key messages you can share with single women or men or LGBTQ community hungry to become parents but are afraid of societal judgment? What message can you leave with them?
I think people are going to always think what they want to think, and they're going to say what they want to say. Whether you're married, unmarried, whether you have a child or you don't have a child, people are always going to find something to say. For me,
Mm,
what becomes very important for people who are unmarried, married, LGBTQ, or whoever you are, what is it that is going to make you happy? Do you want to be a parent, right? And if you
mm,
want to be a parent, and if that is your goal, I encourage all to forge forward, right? And to determine a plan and determine the path that is most appropriate for them, right? And so,
yeah.
because they believe in their hearts that this is what they have been called to do. So, I encourage them to forge forward and to pursue all of their options in order to obtain their goal. And also tell them that you are not alone. Again, there is a village such as Fertility for Color Girls that are here to support you. And there are other people that have walked in your shoes who have made the decision to forge forward to become a parent, regardless of being unmarried or, that they're like, I want to be a parent and I'm not going to have any regrets. And so this is what, I am going to do. And this has been happening. This isn't just something that just started happening in 2020 or 2018. People have been making these decisions since the beginning of time. We haven't really seen, we really don't hear about these stories often. But the reality is that individuals who are unmarried and LGBTQ have been making the decision to become parents since the beginning of time. And so I think that you have to be firm in yourself, you know what I mean, in the understanding of who you are. You have to walk in your own authenticity and love yourself fiercely enough and to be brave enough to say, this is what I want to do. This is what I've been called to do, and forge forward and do.
Thank you very much. That was great. Now we have a little time to address the public question. And one of the questions we received from the public is, can my OBGYN treat my fertility problem?
Well, there is an extent that your OBGYN, they will be able to help you, but they would have to send you to a specialist. In my talking to some people who work at a fertility clinic, I encourage the patient to allow that OBGYN to exhaust everything that they can do, especially if you don't have insurance. So whether that's particular tests or particular medications that you can start off with your OBGYN before going to a specialist, your OBGYN can do, a certain number of things. So I would encourage them definitely to talk to their OBGYN, make sure they put together an extensive plan so that they can exhaust every option. And then, when they get to the place that they may have to move on because they need treatment, they can move on there. When I first started my own journey, for the person who asked that, I actually was working with my OBGYN and the fertility clinic, together. And so, and it was beautiful. God rest her soul, she's not here. But she did everything that she could, until she had to send me, move me forward to a fertility specialist. And then she still, I was still able to talk to her and go see her to kind of bounce things off of her, as well as I worked with the fertility specialist. So they kind of worked hand in hand. And so, make sure that you have a doctor that you trust and that cares for you, so that you can really walk with them and they have a really extensive and exhaustive plan that they can partner with you to obtain your.
Thank you very much for addressing that question. We have another one, and that is, as a provider that serves perinatal women, which type of support may be helpful to offer to clients during this process? Not necessarily as a doctor, but as a support person. What word can we say to help ease the pain that this journey brings?
I think just saying that I'm here for you. If you need anything, let me know. Say I'm praying for you. Again, just letting know whatever way you need me to support you, I'm here. What you shared is confidential, and you're not alone. And so whatever I can do for you, I'm here. You can also share with them confidentially about organizations such as Fertility for Color Girls, to say, hey, I always tell people to say, hey, I know this amazing organization who are helping, Black women and couples and other women of color all over the country. So if you'd like some support, reach out to them or check them out on their website. I think those are some of the things. I've seen women and couples who have sought to support women struggling with infertility purchase books and send little gifts to them, right? And so again, just support them. What's important is that they know you are present, that you see them, as you stated earlier, that you see, that you're into them, see. that you see them, and again, that you support. That's what good friends do on this journey, right? But that not you're critiquing them, judging them, offering them, this voluntary advice. They don't necessarily need that. If they ask you for advice, give it to them. But don't feel like you got to have a long laundry list of things to say to them and advice to give to them. Again, just be present and find out what they need. And if they don't feel like talking, you know, tell them, you can call me if you need to cry, talk, need some ear to, a shoulder to lean on, and somebody just to talk to. I'm here. And I think that was most helpful for me when I was going through my journey.
Yeah, somebody to just hold your hand because it's needed, right? Yeah,
right.
yeah. And I know we have debunked a few myths while we were having this conversation, but I would like you to, what common myth would you like to debunk before we conclude this program? Go ahead, take the floor.
Yeah, I think the one that I've been sharing, this idea that Black women are hyperfertile and we don't struggle with infertility. That's just not true. We do struggle with fertility challenges. And I think that, and because we struggle with it, does not make us bad, doesn't make us weak, doesn't make us less than a woman. It's just simply a challenge and a diagnosis. And there are people in our community um, and in our world, in our cities and our local cities that can support us to help us get through, just as with any other diagnosis. And so just being able to find the persons that you trust and that can support you on the journey to obtain that goal. So for me, I think that that's so important. Black women and couples, and to know that they're not alone, right? Because a lot of times we think that we're alone in that idea, that because we don't think that other Black women and couples are struggling with infertility. And then it leads to so much shame and silence and hurt and us being so wounded. And so if we can just get there and understand that there are more women than we know who are not only struggling now, but who have struggled in years past, but they have also, received help. And the blessing is that now in 2021, we have more resources to obtain the help that we need than people did in our past. And so I think that's a huge blessing, right? That there are so many paths, so many resources to help us to become the parents and the mommies and the daddies that we've always dreamed
of. That's beautiful. Thank you very much, Dr. Stacey. And I would like you to leave our audience with words of encouragement for those who are feeling inadequate, for those who are feeling like less than, for those who are feeling cheated by life because they're on this journey of uncertain outcomes, right? And leave us with word of encouragement and before we conclude today's session.
So for those who feel like this infertility journey has just taken the life out of you, I want to encourage you today and remind you that you are not alone. Myself, as well as other women and couples, and particularly the Village of Fertility for Colored Girls, we are here to support you. And that I also want you to know that if you feel like you've waited and waited and waited, I also want you to know that delay does not mean deny. And I think that even in the delay, even though you've delayed, you may have delayed it for whatever reason, whether it was trying to establish your career, you've been waiting to be in a relationship, or whatever it may be. I want you to know that you can still move forward and become a parent, right? Delay does not mean deny. This season of waiting is just a season of preparation to prepare you for a gift that I believe that God has for you. One of the things that I think that is so important that you remember is that even the babies that you desire, those babies also have a major purpose in their lives. And so one of the things that I had to learn as I prepared for, as I waited 7 years, my own journey was 7 years. I didn't say this in the beginning, but I went through 7 in vitro cycles before I had my daughter, who is now about to be 7 years old. But one of the things I realized is that in as much as I wanted a child at 37, I think that if I would have had my daughter at 37, I would not have been ready. The purpose, um, the earth, the world, and the earth had not aligned itself, and God, for me, needed to prepare me to be the parent that God would have me to be for this little girl that has such an amazing purpose um, on her life. And so I too had to be prepared. And so anybody, for us who are, we have a special request, and our special request is that we want to be a parent. And special requests and special orders take time. And so use this time and this season to allow it to prepare you for the gift. I know you're saying, but I'm ready. I'm ready. Use this time to allow it to prepare you, to solidify your own self and who you are, so that you can be the best parent that you can be to the child that will come. I also want to tell you is that for those who also, like myself, we have it made up in our mind, or we're taught to think that we're going to have a child a certain way. I want you to know that do not limit yourself. There are multiple paths to parenthood, right? There are multiple paths. And everyone's path to parenthood is different, but it is not deficient. It is just different. And so whether you have to go through IVF or IUI, whether you have to end up using a gestational carrier, or using a donor eggs or a donor sperm, or adopting an embryo, or adopting a child, or going through foster to adopt, none of those paths are deficient. They're just different. And when you become a parent through one of those paths, the reality is I have never met a woman or a couple or a man who has loved the child any less, because they know that the child through that path is the one that has been chosen for them, and that they have been chosen to parent. And so I encourage you also to be open. Be open, know your options, research every path, and also be willing to discern and be open to the path that has been assigned for you. But finally, I also say to you, whatever and no matter what you come up against, hold on to hope, and know that you too can become a parent. If you believe, if you trust, and if you hold on. And I am here, and my organization is here for you if you need absolutely anything. But you are not alone, and you are worthy of being a parent. You are deserving of being a parent. And so if that's what you want to do, don't wait any longer today. I encourage you to begin to pick up the phone, whether it's calling a doctor or even calling us to figure out what next steps you might need to take in order to forge forward to become a parent.
Oh, that's amazing, Dr. Stacey. Thank you very much for your words and wisdom. I'm sure our audience benefited from our chat today. 1 hour flew by. Oh my goodness. But before we conclude, I want to talk briefly about the Perinatal Mood Disorders Initiative, funded through the New Jersey Department of Health. We provide free emotional support to women during their childbearing journey, including those who have experienced multiple loss. Through our emotional health and support program, we also conduct support groups, and they are free as well, facilitate community events, and offer education to healthcare providers in Northern New Jersey area. Please visit partnershipmch.org/PPD to learn more about the services that we provide. Just a reminder that a recording of this program will be on the partnership YouTube page. Okay, thank you very much for tuning in today, and I hope to hear from you all and see you all. Thank you, Dr. Stacey.
Thank you so much for having me. God bless everyone.